Saw palmetto, a small palm tree native to the southeastern United States, has been used for centuries in traditional medicine, particularly for prostate health. Today, it's one of the most popular herbal remedies for men seeking to manage symptoms of benign prostatic hyperplasia, BPH, a condition where the prostate gland enlarges and causes urinary difficulties. But does saw palmetto really live up to its claims of improving prostate health? Let's dive into the scientific evidence and understand how saw palmetto works and whether it can genuinely help shrink an enlarged prostate. The main active components of saw palmetto are fatty acids and plant sterols, which are believed to play a significant role in its health benefits. These compounds have anti-inflammatory properties that help reduce the irritation and inflammation commonly associated with an enlarged prostate. By lowering inflammation in the prostate gland, saw palmetto can alleviate symptoms such as frequent urination, weak urine flow, and the feeling of incomplete bladder emptying. This makes it easier for men to manage the discomfort of BPH and improve their quality of life. One of the key mechanisms by which saw palmetto may help reduce prostate size involves its ability to inhibit the enzyme 5-alpha reductase. This enzyme is responsible for converting testosterone into its more potent form, dihydrotestosterone, DHT. DHT is thought to contribute significantly to prostate growth. By blocking this enzyme, saw palmetto helps to decrease the levels of DHT in the prostate, potentially slowing or reversing prostate enlargement. This process can also help with reducing hair loss in men, which is another common use for saw palmetto. Additionally, saw palmetto has been shown to exhibit antioxidant properties, which help protect the cells of the prostate from oxidative stress. Oxidative stress occurs when there is an imbalance between free radicals and antioxidants in the body, leading to cell damage. This damage can accelerate the growth of prostate cells and worsen BPH. By neutralizing free radicals, saw palmetto may help protect prostate cells from this damage, supporting better overall prostate health. Clinical studies on saw palmetto's effectiveness in treating BPH have been mixed, with some showing promising results while others are inconclusive. Several studies have reported that men who take saw palmetto experience improvements in urinary flow, reduced nocturia, waking up at night to urinate, and a better overall sense of urinary function. However, not all studies have shown such clear benefits, and the effects can vary depending on the dosage and the form of saw palmetto used. It's important to note that while saw palmetto may offer some relief, it may not completely eliminate the need for medical intervention in severe cases of BPH. Despite these mixed results, many men find that saw palmetto can help manage mild to moderate symptoms of an enlarged prostate without the side effects associated with pharmaceutical treatments. Unlike prescription medications, which can come with a range of potential side effects like dizziness, headaches, and sexual dysfunction, saw palmetto tends to have fewer adverse effects. However, it's important to be cautious and speak with a healthcare provider before starting saw palmetto, especially if you are already taking medications for prostate health or other conditions. Saw palmetto is available in a variety of forms, including capsules, tablets, and liquid extracts. The standardized extract, often labeled as 85 to 95% fatty acids and sterols, is the most commonly recommended form for prostate health. The dosage can vary depending on the product and the severity of the symptoms, but most studies suggest a daily dose of 160 to 320 milligrams of saw palmetto extract for optimal results. It's essential to follow the dosage recommendations and consult a healthcare professional before starting any new supplement regimen. There are some concerns about the purity and quality of saw palmetto supplements, as the market is flooded with products of varying strengths and ingredients. It's crucial to choose a reputable brand that guarantees the potency and quality of its ingredients. When looking for saw palmetto supplements, make sure to choose one that offers standardized extracts to ensure consistent dosing and effectiveness. It's also important to be cautious of products that make exaggerated claims or don't provide clear information about their ingredients. Despite its potential benefits, saw palmetto should not be viewed as a cure-all for prostate problems. While it may help manage symptoms and improve quality of life for many men, it's important to remember that BPH is a complex condition that may require a multifaceted approach to treatment. Saw palmetto can be an effective part of a broader treatment plan, which may include lifestyle changes, medications, and in some cases, surgical interventions. Always consult a healthcare provider to determine the best course of action based on individual needs and health conditions. In addition to its use in prostate health, Saw Palmetto has other potential health benefits. For example, it has been investigated for its role in promoting hair growth, especially in cases of androgenic alopecia or male pattern baldness. The mechanism behind this effect is similar to its action on the prostate. By blocking the production of DHT, Saw Palmetto may help prevent hair follicles from shrinking and prolong the growth phase of hair. While more research is needed in this area, some men have found Saw Palmetto supplements helpful in reducing hair loss. Another area of interest for Saw Palmetto is its potential to support overall male reproductive health. Some studies suggest that it may improve sexual function and libido, though evidence is limited. While it's unlikely to serve as a primary treatment for erectile dysfunction or other sexual health issues, Saw Palmetto's anti-inflammatory and hormone-regulating properties could provide some benefit in certain individuals. Although Saw Palmetto is generally considered safe, it can interact with certain medications, particularly blood thinners, hormone therapy, and drugs that affect the liver. It's important to talk to a healthcare provider before using Saw Palmetto, especially if you have any underlying health conditions or are taking medications. Additionally, because it can affect hormone levels, it may not be suitable for women, particularly those who are pregnant or breastfeeding. It's also worth mentioning that the effects of Saw Palmetto may take time to become noticeable. Unlike some pharmaceutical treatments that may provide quick relief, herbal remedies like Saw Palmetto may require several weeks or even months of consistent use before results are seen. Patience is key, and while some people may experience significant benefits, others may find only mild improvements. It's essential to manage expectations and continue working with a healthcare provider to monitor progress and adjust treatment as necessary. To further understand the benefits of Saw Palmetto, it's essential to delve deeper into its specific mechanisms and broader health implications. Saw Palmetto, scientifically known as Serenoa rapine, is a plant whose fruit contains a variety of bioactive compounds, with the most studied being its fatty acids and plant sterols. These compounds are thought to interact with the body's hormonal and inflammatory pathways, making Saw Palmetto a valuable herbal supplement for prostate health. It's especially noteworthy for its ability to manage symptoms associated with benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate that affects many men, particularly as they age. One of the significant ways Saw Palmetto may aid prostate health is by influencing the body's testosterone metabolism. As mentioned earlier, the enzyme 5-alpha reductase plays a crucial role in converting testosterone into dihydrotestosterone, DHT, a potent androgen that is largely responsible for prostate growth. Saw Palmetto inhibits this enzyme, which in turn reduces the production of DHT in the prostate. By lowering DHT levels, Saw Palmetto may help to reduce the size of the prostate over time, improving urinary function and alleviating symptoms like frequent urination or difficulty starting and stopping urine flow. This effect is particularly beneficial for men with BPH, as DHT is considered one of the main drivers of prostate enlargement. In addition to its hormonal effects, Saw Palmetto is also known for its anti-inflammatory properties. Chronic inflammation in the prostate can worsen the symptoms of BPH, leading to pain, urinary retention, and discomfort. Saw Palmetto's fatty acids and sterols may help modulate the inflammatory response by inhibiting pro-inflammatory molecules such as cytokines and prostaglandins. This can lead to a reduction in prostate swelling and an improvement in urinary function. Moreover, by alleviating inflammation, Saw Palmetto may help reduce the frequency and severity of nighttime urination, which is a common complaint among men with prostate problems. Furthermore, Saw Palmetto may have some neuroprotective properties, which means it might help protect the nerves involved in the urinary system. This is significant because the nerves that control bladder function can be affected by prostate enlargement, leading to problems with urination. Saw Palmetto's potential to support nerve health could improve the communication between the bladder and brain, resulting in better bladder control and a reduction in symptoms like urgency or the sensation of incomplete bladder emptying. Another area where Saw Palmetto shows promise is in its role as a natural diuretic. By increasing urine flow, Saw Palmetto may help flush excess fluids from the body, further relieving symptoms such as urinary retention and bloating that often accompany BPH. It may also help improve overall kidney function, as better fluid regulation can reduce the strain on the kidneys, which are responsible for filtering waste from the blood. This additional benefit may make Saw Palmetto a useful supplement for men who also experience mild kidney issues, though it should not replace medical treatment for serious kidney conditions. Despite these potential benefits, it's important to emphasize that Saw Palmetto is not a guaranteed cure for prostate enlargement or BPH. While many users report positive results, the degree of effectiveness can vary. In some cases, the herb may provide only modest relief, particularly for individuals with more severe forms of BPH. For this reason, men experiencing significant symptoms of prostate enlargement should not solely rely on Saw Palmetto as a treatment option. It should be part of a more comprehensive approach that includes regular medical monitoring, lifestyle modifications, such as a balanced diet and exercise, and, if necessary, pharmaceutical or surgical interventions. In clinical trials, the results of Saw Palmetto's efficacy have been mixed. Some studies have found significant improvements in urinary symptoms, including a reduction in urinary frequency, urgency, and nocturia. Other studies, however, have shown no substantial improvement in prostate size or urinary function. The inconsistency in results may be due to variations in the formulations used in different studies, the dosages, and the specific populations tested. Furthermore, the placebo effect may play a role in the positive reports from some users, as many men find that any treatment offering relief, whether it's a natural remedy or a pharmaceutical, is beneficial. This highlights the importance of setting realistic expectations when using Saw Palmetto and acknowledging that results may not be the same for everyone. Another limitation of Saw Palmetto is the lack of long-term studies regarding its safety and efficacy. While short-term use of Saw Palmetto has generally been deemed safe for most people, the long-term effects are not yet well understood. Some individuals may experience mild side effects, such as digestive discomfort, headaches, or dizziness, though these are typically rare and tend to subside once the body adjusts to the supplement. However, there have been concerns about Saw Palmetto's potential to interact with medications, especially blood thinners, hormone-based therapies, and medications metabolized by the liver. As with any supplement, it's crucial to consult with a healthcare provider before starting Saw Palmetto, particularly for individuals on other medications or with pre-existing conditions. While Saw Palmetto's primary use is for prostate health, its benefits extend beyond the prostate. It has been explored for its potential role in promoting hair growth, particularly for men dealing with androgenic alopecia, or male pattern baldness. By reducing DHT levels in the scalp, Saw Palmetto may help prevent hair follicles from shrinking and prolong the anagen growth phase of the hair cycle. Though the evidence is still limited, some men have found that Saw Palmetto helps slow down or even reverse hair loss, making it an attractive option for those seeking a natural alternative to traditional hair loss treatments.